Hi, this is Yvette with the KMC University HelpDesk. I wanted to come to you today with some concerning statistics that we are still seeing at KMC University. Despite our message for many years being, make sure you are documenting appropriately, make sure you're coding appropriately, we continue to see things showing up on our coding audits that we're doing at KMC University. Also, we're seeing them in records requests, and we're seeing them in letters that payers are sending to several of our clients stating, hey, you're on an outlier report. I'm not saying you're doing it wrong. I might want to come knock on the door here soon. Just want it to be on your radar. You're using the same services over and over. So when we really think about Medicare and where they really became on the I want to scrutinize this was back around 2014 to 2017. And this is when they looked at the error rates within chiropractic. They found initially it was 54.1%, and then they finally saw it get down to 41.7%. That is a good number to keep in mind. We can see our trend of going downward there, and I believe you'll see that as we move across into the next report I want to show you. But it's still too high. We want to be coding spot on. It's been our message for a very long time. Code appropriately for your services. It is hard for several of you who do full spine adjusting to understand why you may not use the 98941. Or with other modalities or procedures, why I may not do this frequency. Why can't I do an hour of massage? Why can't I do this? These are things that we love to educate you on, and it's been our message for years. So I want to fast forward us just for a moment and take you over to a report by Medicare. It was their 2022 Medicare fee-for-service supplemental improper payment data. And I thought, well, if there was one back then, there has to be one a little bit more current. And it coincides with the site I'm going to show you at the end that should empower you to see how Medicare views you. Maybe you've already gotten a letter and you already know how you're viewed. Maybe we've already audited your codes and we're telling you how it's viewed. But let's take a look in here and see what they have to say. Across the board, Part A, Part B, all of the participants, you will see that the most common mistake is insufficient documentation. There are some that have no documentation, which, doctor, if it's not signed and if it's not written, no wonder they can't collect at the front desk, because the service cannot go in to be charged to anyone until the documentation is in to support it. Don't send billing out without that being done. If you're worried about that, give us a call. Let us help you figure out ways to get a better system in place for getting documentation taken care of in a timely manner. But the biggest problem here, again, is insufficient documentation. It's what we've seen for years. It's what we've preached for years. So I want to move it forward to the next screen. This one gave me significant heartburn. When I look at the error rate percentage and where they went and took it from who's the worst in the percentage of error rate all the way down through what's the least, we hit number one. And what I do want to bring back is, now remember we had 41.7% back at the end of their study before. Here in this 2022, it's to 31.3%. So I hope our investment into this profession is paying off, and then you're digging into learning how to properly code for services is also helping you. But still, we're number one. So when we look at other areas, obviously, we don't charge what a lab may charge for certain services. We're not charging for orthopedic surgery or neurology. Really, what Medicare covers in our office is so small. When we think about our dollar amount that's going to show up on this next screen, I believe, that shows us right in the middle, that's concerning to me. But we have the highest percentage rate of error, and it's all around our insufficient documentation. The other areas are just frivolous. I mean, they're there, the no documentation, the medical necessity not being supported, and incorrect coding, and then other. That's not okay to have your documentation lacking. Number one, this takes it back to your state board, your malpractice, Medicare, your individual payers, and just your good storytelling for your patient. It needs to be written. It needs to have rationale in that note. All the components need to be there. If you're struggling with this, we'd love to help. We talk about it all the time. Let's go forward another screen. And this is the one where they did the highest improper payment all the way down to the lowest. I felt concerned because, again, 20 something to 40 some dollars is the normal reimbursement with Medicare for spinal CMT, and we don't bill them for all of them because some are maintenance. I got really concerned because we're middle of the road, and orthopedic surgery fell below us, neurology fell below us, and I just really was perplexed by that in our clinics. I noticed that up higher, that you've got physical therapists in private practice. They were up on that naughty list of the highest percentage of improper payment. Now, as I fast forward over one more, I can see the area that was commonly reviewed, which was what? The 98941. 204 claims reviewed, 267 lines. Out of nearly $9,000 of payments made, 3,000 of it was improper. So there we have the 32%. It's too high. And as a profession, we want to get that down. If you look over here in our confidence interval, we're off the chart. We need to clear this up. So if you're wondering, oh my Lord, where do I look? Number one, think about doing a practice billing profile with us. That'll tell you exactly what other payers are seeing. And then here's one thing I'd like to steer you towards. If you've been in Medicare for a while, you should be able to go out to this particular site, stick in your first name, last name, and find provider, or your 10-digit MPI number. Look yourself up and see what Medicare says. As I had a practice billing profile yesterday, they kind of seemed a little shocked by their 99 point some percentage of 98941. And it was like they almost thought that that's what I saw. I thought, well, I'm just going to take you on a journey with me really quick. And I brought them straight to this site. I plugged it in and they're like, I said, yeah, look, 100% of the time you're 98941. Oh, well, can you pull up the other provider in our office? So, okay, name, pull it up. 100% of the time, 98941. If you're one of these people that notice this trend in your office, cookie cutter or high usage of a specific code, let us take a look. Let us help you. I sure hope this edition of the Help Desk has helped you today and will empower you moving forward. We're here to help. Give us a call. Go on our website, use the chat feature. However you need to get a hold of us, know that we'll be on the other end waiting to help you. Have a beautiful day. Before you go, don't forget to like, share, and follow KMC University on all of our social media platforms. If you're on Facebook, take a moment and go over to the Chiropractic Reimbursement and Compliance Experts. Click join. You will be happy you did. Have a wonderful day. Bye-bye.